Hi, I'm Dr. Philip McMillan. Thank you for joining me. And I'm here to be talking about the COVID vaccine gamble on children. Why would I say that? In everything in medicine, everything is about risk and benefit. And in the context of COVID-19, we have always known who was high risk: older people, comorbidities. They represented, based on the US study, almost 97% of deaths around severe COVID-19. Children were always a low risk. Now, you have to classify that and clarify that because children with comorbidities may be at slightly higher risk, but not as high a risk as older adults with comorbidities. But they may even be higher risk potentially, depending on their condition, than children who are quite healthy or even adults who are quite healthy. And so vaccinating children with comorbidities could also make perfect sense. So, why am I talking about this? Well, this is because we're going to focus on the recent change from the WHO with regards to the guidance about vaccines across the world. And this is a general statement that they have done. And I'm going to come back to that in just a minute. But before I start, what I wanted to do was just remind people that essentially in the next few days, about 10 days' time, sudden deaths at home are rising. There's going to be a link below for you to click on if you want to join me on Eventbrite to hear about this, and I'll try and break it down. I've put the list of topics that I'll be dealing with. So if you're interested, please join me on Eventbrite. So getting back to the COVID vaccine gamble in children, here is the SAGE update with regards to the vaccination guidance. And you can see here that this was released on the 28th of March, 2023. Now, in this, they were focused on the fact that they have reprioritized the use of COVID-19 vaccines. And when you look in a little bit more detail, they've broken it down into three groups. High priority, that's full vaccination and additional boosters every 6 to 12 months. Then medium priority, which includes healthy adults under the age of 50 to 60. And they recommend primary series and first booster of vaccines. And then the low priority group. And that includes healthy children and adolescents up to 17 years old. As far as they're concerned, primary and booster doses are safe and effective in children and adolescents. And what does that actually mean? What that means is, based on current evidence, that they haven't found any major issues other than myocarditis, of course. But as far as the recommendations are, that's not a significant risk and it's a low priority, and therefore vaccination is still recommended for children. And that's where I'd get into a very important discussion that I had in February of 2022. And this was with Dr. Ros Jones, pediatrician who was retired. And so she was very upfront, very straight to the point. It wasn't really accessible on YouTube because I had to bring it down. At the time, there was a lot of censorship going on, and that was one that was so straight talking that it may have caused some issues. I think what she had said last year was borne out with the decision from SAGE. And as such, I think it's very important for people to reflect on it even now. And so I'm going to play you a short clip from it. And remember, the full link is in the description. And let's hear what she had to say at that point. There, to get the vaccines coming on board, which would be about late December. At that time, did you have any thoughts that children would become involved in this program?
No, I was assuming this was going to be, I remember Patrick Vallance in one of the press conferences saying that if we vaccinated all the over 50s and everybody with health vulnerabilities, then that would have accounted for more than 98% of the deaths in the first wave. And as far as I know, that was the aim. And that's what Kate Bingham, the vaccine czar, was saying. They were obviously giving it to some younger people because they were giving it to healthcare and social care workers. but they were not, and Matt Hancock was very clear this would not be a vaccine for children. And I think the first point at which I thought this is a little bit odd was when I actually saw an advert on our Thames London News one evening for children to sign up for the Oxford AstraZeneca children's trial. And at that stage, we'd got no adult safety data. And I thought, what on earth is going on here? And I emailed Andrew Pollard, who I kind of know vaguely because I've worked in the same region and I've referred him patients in the past. And he emailed me back within the hour saying, oh, hi, Ros. Yes, you're absolutely right. We don't know it's safe. That's why we're doing the study. And I spoke to him in a Zoom call in which he was very clear this was just a small pilot study. And if it seemed that children needed the vaccine and if they mounted a good immune response, which of course they did, why wouldn't they? Then they would do a properly powered full-size study, and that there was no way this vaccine would be going out to children within the year. I mean, that was in sort of spring 2021.
So could you clarify who Andrew Pollard is?
Yes, he's he's chairman of the JCVI, and he's the senior investigator for the Oxford AstraZeneca trials.
I see. So very early on, there seemed to be a push towards getting children. And it doesn't seem, did they at any point start to indicate why there was a change in direction at that point?
I wouldn't say so, really. No, I think there was a feeling that it was just being pushed. There was a lot of comments last summer from people saying, oh, you know, as soon as we finish the rollout for adults, we need to go straight to children. I mean, all the way along the line, once we got to under 50s, it had to go to under 40s. It was always, there was this race. I can remember Sajid Javid saying, we're going to hit the ground running. This was last summer when the MHRA gave temporary use authorization for this vaccine for children for 12 to 15s in June of 2021. But it wasn't until mid-July, about 6 weeks later, that the JCVI said, actually, we don't think it's appropriate. The balance of benefit and risk is too close to call, and it's not suitable for a mass rollout to healthy children. It was obviously already by then authorized for children with major comorbidities. And that's different. I'm not talking here about children who've got huge risk factors for COVID.
Yes, and I thought that was an incredibly important discussion that she had highlighted there. And in the context of how we look at the vaccination in children, the fact that we have a change in the WHO recommendations, why was that not relevant at the beginning? Because they are clearly saying, depending on the priorities, you could argue that they were saying now that in the context of what they're doing, they are prioritizing other essential traditional vaccines, rotavirus, measles, pneumococcal conjugate vaccines. And so they're saying that these are now more important than COVID vaccines. And therefore, unless you have vaccines to spread around to the whole population, which probably some countries do, then don't go ahead to do it generally, because unless they're children with immunocompromised conditions and comorbidities. Why, therefore, then was this used on children who were healthy? Now, just remember, in the context of vaccine safety, here are the words that a retired pharmaceutical regulator had said. She said, when you are developing vaccines, especially for children, you must remember that you are giving a vaccine to a healthy child to prevent future disease. You therefore have to be absolutely certain that the vaccine doesn't create a disease that you did not anticipate. That would defeat the whole purpose of trying to prevent disease in the future. In a low-risk cohort of patients, there is almost no sensible excuse as to why you would take that risk. But that's the way things are at the moment. And I'm very happy that the WHO has taken that position, because that seems to be the logical position. It's a pity that it has taken a year for that to occur. And what of all the children who have already been vaccinated? Are we saying that that was of no value? Have we looked at the longer term risks? We don't know. Those are the unknown unknowns. We can only hope that there are no longer term risks, but it's important to recognize that that is a hope rather than accurate knowledge, because the time has not passed for longer term studies. Thank you for joining me. I hope you found that information valuable. Have a great evening.